Hi, this is Larry Kaiser, the Vice President of Marketing and Communications at Optimum Healthcare IT. Most Wire is an extremely important award for both healthcare and the communities that healthcare organizations serve because it shows the desire and willingness to have the best technology to provide the best patient care. The organizations that win this award are at the top of their game when it comes to improving the health and the care of their communities. We would like to recognize Parkview Health for earning the Most Wire designation. Congratulations on achieving this high level of excellence.
So, what would I tell other healthcare organizations who are looking to leverage digital technology? I think the biggest thing that we found at Parkview is that it's really important to have a shared vision of what's possible. So, at Parkview, we use a now, near, far plan. We look at everything in that context, and so we've developed a shared now, near, and far plan that lays out what is possible today. Maybe the caregivers and business people don't know what's available, but what's available today, what's in the near future, and then what's a little bit further out. And so, as we think about creating that shared vision, we really spend a lot of time with our patients, customers, et cetera. So first and foremost, we always think it's important to put our patients first. And so we really want to know what our patients need, want, think they need, and maybe even to identify those things that they possibly don't know they need yet. How many of us remember when we didn't think we needed an ATM card, and yet I've not been in a bank in years? So we are always looking to see what that future might look like. Then we really spend a lot of time with our IT team and have them become the experts. They spend countless hours in the business areas and in the clinical areas learning and becoming the experts, not only on the technology that we deploy, but the processes and workflows that are out there. We find that by doing that, you start to develop these relationships with the caregivers. You start to develop relationships with patients, with families, with providers, and those relationships are really key to your future success. Um, Often it becomes those relationships that allow you to get things done, get that shared buy-in, and move things through quickly. As I think about this, it's better to understand the process and work with the customer to come up with a shared idea, a shared process, a shared project, a shared initiative, rather than just receive that project over the fence. You know, a lot of times we've received those projects that just get thrown over the fence. But if you are really engaged with your customers and partnering with them, they will help you develop that shared vision. And I think that's really important to our future. Um, by immersing yourself, like I mentioned, there are those relationships. And I think that the relationships are really built on trust and transparency. And often we talk about um, being the yes department or the frictionless department, a department that you don't have to work hard to deal with from an IT perspective. We don't want to be the department of no, but we rather want to be that department that has frictionless service. If we do that, our customers, providers, patients, families, caregivers, whoever that might be, our customers will seek us out to help develop good solutions. If we don't have that frictionless engagement with them, then they will go outside, they'll find some third party solution, they'll find some other tool that they think is their solution and use it. And so I think it's really important if we can build those relationships and those partnerships that we can accomplish much very quickly. Finally, I think it's important to constantly be reading, learning, innovating, researching, all the new technology. Healthcare is moving very, very rapidly, as is technology. And so it's really important that if you don't constantly read, research, learn, and innovate, you will quickly fall behind. And it's really hard to catch up once you're behind. So I think that's a key component of everything we should do is continue to focus on research. Um, Take some risk. I think that's part of this innovate and learning part. We have a philosophy that we'll take some risk. It's really important to continue to innovate and try things. Attempt to do things that you might not normally do. And maybe you have to, and you'll fail. But I would rather you get 3 out of 5 right than 2 out of 2. The whole idea is we try a lot of things and we're at least making progress. Even if we fail occasionally, it's important to keep moving things forward and innovating. At Parkview, we have the advantage of having a very engaged uh, board, Parkview Health Board of Directors. We have an IT committee of the Parkview Health Board. We have physician leaders and senior leaders and coworkers that are all actively engaged in helping us create this shared vision. So we use all of that information from those diverse backgrounds, diverse specialties, and in the case of the board members, diverse industries, to really give us insight into where we should be going. So I think it's really important to actively listen to all of those constituents and understand what they want as you develop that shared vision. Once you develop that shared vision needs to be very simple, easy to follow, and flexible. When we develop our shared what's possible plan or our now near far plan, we look to the future. We excite people about what's possible. But as things change, so does that near now far plan change. Things move forward, things move backwards. But the idea is it gives us a general vision that we're all working towards. And then we develop our initiatives and our projects around that plan so that we're filling in the gaps to move us across the continuum. I think that was really important when we think about COVID-19. In COVID-19, we had a plan. We knew what the future looked like. Um, we had uh, we had a vision of what the future looked like. We had a partial plan put together of how we were going to get there. Um, but all of a sudden, we had to move the future, what is far and maybe what is near and far, into the now overnight. We had to figure out how to get there overnight because we had already done the groundwork. We had already worked through many of these processes. It was pretty easy, and we were successful in sending over 4,000 coworkers home within the first week. It's truly amazing if you have a vision, a shared plan, what you can accomplish. Our, our caregivers, our physicians, and our leaders all knew what was possible. They knew that we could accomplish all these things because we had already put the vision out there. And so it was just making it happen and bringing the resources to bear to make it happen. So I think that plan is really important. So when I think about all of this and try to summarize, I think there's about a few key points. I think the first and most foremost is focus on the patient. I think it's really important for your teams to become the experts. They are the go-to people. They have that trusted relationship. I think developing those trusted relationships and partnerships through transparency, and if you're transparent with your partners or your customers, they're really understanding when things don't go well because you've really talked to them. They understand everything about it. So I think that's a really important part. Um, Transparent and frictionless interactions. The idea that if it's easy to do business with your IT department, if it's easy to do business with you, your customers are going to come to you and ask you to help drive those solutions. If you don't, if you make it difficult, they will go out and find other solutions. And then finally, constantly learn, innovate, evolve, and adjust. And we constantly are looking to ways to innovate. We're always looking for new technology, how it can be applied, what the future might look like using that technology. So I think that's in summary what I would say is create that shared vision using those four or those 5 guiding principles. Thank you.